I'm Jonah Comstock, Editor-in-Chief of Pharma Forum. I'm joined by Dr. Steve Devine, the Chief Medical Officer at NMDP, formerly the National Marrow Donor Program.
Correct.
So tell me a little bit, before we get into why you're here at ASCO, tell me a little bit about NMDP and what you guys do.
So we run one of the world's largest donor registries. This is for donors for people who need a blood or marrow transplant. And we provide access to over 41 million donors globally. So we help people who need to be treated with blood or marrow transplantation and help find donors for these people, and actually then not only find the donors, but actually deliver the products to the transplant centers.
We were talking a little bit before this interview, and you were telling me that marrow donation in particular has undergone a big change in the last few years in terms of what you're able to do and what you need. Can you tell me a little bit about that?
Yeah, things have changed a lot over the last decade. First of all, most of the donors used to donate their bone marrow and they had to undergo an operation. But now the vast majority of donors actually don't have to have a bone marrow harvest. They can just donate their blood, which is a lot safer for them, easier for them. So that's the good news for donors. It's a lot easier nowadays. The other thing, which is I think the big news for patients, is that years ago it would be very difficult to find donors for all the patients. In particular, there are big gaps in our ability to find donors based on your ancestry. So people who are more racially or ethnically diverse were less likely to find donors than non-Hispanic white people. So the big news now that we're presenting at this meeting is that virtually everyone has a donor. So if you need a blood or marrow transplant, you can have one.
That's really big news. So tell me about the presentation. What's the research specifically that you're presenting, and how new is it?
So NMDP has a research organization called the CIBMTR, or Center for International Blood or Marrow Transplant Research, which conducts both observational and prospective studies. So we have been doing a series of studies looking at these mismatched unrelated donors, and the results are very, very encouraging. And so encouraging that we submitted some of our preliminary data to this meeting, and it was selected as an oral abstract. So what we're showing is people who are in need of a transplant, so who have acute leukemia or other diseases that could be benefited by transplant, have very good outcomes even with donors who are not fully matched. So that's news, and the results really look similar to what we would see for people who have fully matched donors.
And is that because of some change in the technology and how you're managing these donors, or is it just like this has been the case all along and we're just now discovering it?
No, actually, it's kind of a twist. So we use a drug that's been FDA approved for years. So this drug called cyclophosphamide has been around for decades, but we give it a different way after the transplant to prevent a complication called graft versus host disease. And it's been a game changer. It's allowed us to improve the outcomes in matched but also mismatched transplants, both from relatives as well as volunteer donors. So truly everyone has a donor now.
How has the advent of cell therapy for, and its potential in these blood cancers changed what you do and the demand for transplants and things like that?
It has changed the demand for diseases like lymphoma and myeloma. We're seeing people going more to the cell therapies, the CAR T therapies for lymphoma, for myeloma. However, for acute myeloid leukemia and myelodysplastic syndrome, which are the key indications for adult transplants, they really haven't proven to be that effective. So blood or marrow transplantation is still the most effective treatment for those diseases, and we're seeing demand actually rise, particularly now that we can find donors for everybody.
And what about sickle cell? I remember that bone marrow used to be the only treatment for that, and now they've just approved these other two.
Yeah, the gene therapies have come around and are really a significant advance for patients with sickle cell disease, but access and capacity issues I think are going to be the problem. So transplantation is still a very viable alternative, particularly for the younger patients. And I think what we're going to learn over the years is whether these matched and mismatched unrelated donor transplants are also an effective, including a cost-effective therapy for things like sickle cell disease.
In general, I mean, it's the first day of the conference, so it's hard to talk about what you've heard so far. But are there any trends um, you're keeping an eye out for? Anything you're excited to hear about? What are you on the lookout for here at
Well, I
ASCO?
think today the session that our presentation on the mismatched transplants is all about immune therapy for hematologic diseases. So I still think that's the big buzz is, how do we use the immune system, whether it's from a donor or from the patient's own immune system, to eradicate the cancer and do it safely and effectively. That's still a big story, and I think, we're seeing what we've learned from blood and marrow transplant actually being applied now to solid tumors and even autoimmune diseases. So that's the other part of the story. Will cell therapies finally be effective in diseases like colorectal cancer, pancreatic cancer, lung cancer, etc.?
And all that kind of comes out of the work that was done before with transplants.
I think a lot of what's been learned from the graft versus leukemia effects and things in transplantation are now being transplanted to more effective therapies for both heme malignancies as well as solid tumors.
Interesting. So there's one question I'm asking everybody I talk to. It's not a newsy question, but what advice would you have for a young professional just starting out in oncology in the space today?
That's a tough one. I mean, I got involved because I found a mentor who was so enthusiastic about bone marrow transplantation. I was sort of like, what is that guy? He was so excited about what he was doing. So I think one of the most important things you can do is actually find a great mentor, find someone who loves what they do, is passionate about what they do, and latch onto that person. And don't just find one mentor, try to find many mentors. So I think that's a key to being successful and really having a great experience in oncology.
What makes you passionate about what you do now?
It's still exciting. I think I'm passionate because we're really seeing some of the research lead to breakthroughs, and we're not just doing the research, we're implementing it into standard of care. So patients are benefiting from what we're doing in research much faster than ever before. That makes me excited, makes me continue to want to do this because things are really coming around and we're making progress much faster than ever before.
Awesome. Well, thank you so much for talking to me today,
It's my
Steve.
pleasure.
It's great.
Great. Thank you.